to discuss the first two anti-cancer antibiotics out of 8 members that we're gonna pour over in this presentation. First is bleomycin, which inhibits synthesis of DNA, binds to DNA leading to single and double strand breaks, also inhibits to a lesser degree RNA and protein synthesis. As you can see in the picture here, DNA bleomycin ferrous complex is converted to DNA bleomycin ferric complex, yielding superoxide and hydroxyl radicals cause DNA strand breakage. Second is dactinomycin, which binds to guanine portion of DNA, intercalating between guanine and cytosine base pairs, inhibiting DNA and RNA synthesis and protein synthesis. When it comes to mitomycin as anti-cancer antibiotic, cell cycle non-specific chemotherapeutic agent, we have 3 pharmaceutical dosage forms for mitomycin. Which can be listed as follows. Mitomycin systemic alkylates DNA to produce DNA cross-linking, primary with guanine and cytosine pairs, and inhibits DNA and RNA synthesis. Mitomycin is not cell cycle specific but has its maximum effect against cells in late G and early S phases. Mitomycin ophthalmic during use in trabeculectomy filtration surgery for glaucoma. Mitomycin topical ophthalmic application alters conjunctival vascular endothelium and inhibits fibroblast proliferation, which is one of major complications of the filtration surgery. Mitomycin urethral gel. Following installation into the pilocalcium system, mitomycin urethral gel forms a semi-solid gel that dissolves from normal kidney urine flow, releasing mitomycin. To fully understand the anti-cancer antibiotic, we have to remember topoisomerase 1 and 2 and their effects on the DNA. Topoisomerase 1 is an essential enzyme for normal development. Its major function is to relax supercoiled DNA and alleviate the DNA helical constraints. When it comes to the topoisomerase 2, which is an enzyme that is able to break and rejoin double-strand DNA molecules. In this way, it can control the topological state of the DNA. In the next 5 slides, we're gonna learn extraordinary information about the third anti-cancer antibiotic. The third anti-cancer antibiotic, doxorubicin. Doxorubicin participates in a wide range of free radical reactions. The drug can undergo 1 electron reduction to the corresponding semiquinone, leading to the generation of superoxide and hydrogen peroxide. Additionally, the drug causes the disappearance of cardiac glutathione peroxidase, leaving the heart with no means of disposing of the hydrogen peroxide, thus generated, leaving the heart with no means of disposing of hydrogen peroxide, thus generated, leading to cardiac toxicity. Doxyl liposomes retain the drug payload during circulation and accumulate preferentially in tissues with increased microvascular permeability, as often is the case of tumors.
Doxyl toxicity profile is drastically different from that of doxorubicin
and is characterized by dominant and dose-limiting mucocutaneous toxicity, mild myelosuppression, minimal alopecia, and no apparent cardiac toxicity. As you can see, doxorubicin interacts with molecular oxygen, producing superoxide ions and hydrogen peroxide, which cause single-strand breaks in DNA. Conventional systemic doxorubicin, adriamycin. It inhibits DNA and RNA synthesis by intercalation between DNA base pairs and by inhibition of topoisomerase 2 and by steric obstruction. Doxorubicin intercalates at points of local uncoiling of the double helix. Although the exact mechanism is unclear of the doxorubicin, it appears that direct binding to DNA intercalation and inhibition of DNA repair to topoisomerase 2 inhibition result in blockade of DNA and RNA synthesis and fragmentation of DNA. When it comes to the liposomal doxorubicin, which is also a powerful iron chelator, the iron doxorubicin complex can bind DNA and cell membranes and produce free radicals that immediately cleave the DNA and the cell membranes. Doxorubicin inhibits DNA and RNA synthesis by intercalating between DNA base pairs, causing steric obstruction and inhibits topoisomerase 2 at the point of the DNA cleavage. Doxorubicin is a powerful iron chelator, and the iron doxorubicin complex can bind DNA and cell membrane, producing free hydroxyl radicals that cleave DNA and cell membranes. Liposomal doxorubicin is a pegylated formulation which protects the liposomes and thereby increases blood circulation time. Liposomal doxorubicin is doxorubicin contained in tiny spheres called pegylated liposomes. These spheres keep the doxorubicin in the bloodstream longer so that more of the drug reaches the cancer cells. Liposomal anthracyclines. As you can see in the picture, the co-presence of phosphate molecules, hydrophilic head, and fatty acid hydrophobic tails plays an important role in this vesicle phenomenon. The phosphate group interacts with water H2O molecules, while the hydrophobic tails escape from water molecules and interact with each other. Calyx or Doxil is a novel pegylated liposomal formulation of the first generation anthracycline doxorubicin. As you can see, the yellow particles of doxorubicin is encapsulated in the liposomal aqueous core. Calyx pegylated liposomal is doxorubicin hydrochloride encapsulated in liposomes with surface-bound methoxypolyethylene glycol (MPEG). This process is known as pegylation and protects the liposomes from detection by the mononuclear phagocyte system (MPS), which increases blood circulation time. Liposomal anthracyclines were developed to decrease the risk of cardiotoxicity experienced with the conventional doxorubicin while preserving the anti-tumor efficacy. Liposomal anthracyclines achieve lower cardiotoxicity by changing tissue distribution and by decreasing rate of drug release. Pegylated liposomes exhibit positive results such as prolonging drug circulation, enhancing circulation in tumors, permeability as well as retention effect, and attenuate side effects. Finally, we should notice that the steric effect of the surface modification of the liposomal nanocarrier with polyethylene glycol chains allows it to avoid the reticuloendothelial system's absorption, prevent the mononuclear phagocyte system from identifying the phagocytosing drugs. Liposomal and the conventional doxorubicin price comparison for the Doxil intravenous each milliliter costs around $79.56 for each 2 mg per milli, compared to only 36 cents to $1.71 as a cost for each milliliter of conventional intravenous doxorubicin with a concentration of 2 mg per ml. In this slide, we will discuss the last 4 anti-cancer antibiotics mechanism of action out of the 8 members in this presentation. Ibaropicin is an anthracycline anti-neoplastic agent known to inhibit DNA and RNA synthesis by steric obstruction after intercalating between DNA base pairs, active throughout entire cell cycle. Intercalation triggers DNA cleavage by topoisomerase 2, resulting in cytocidal activity and generates cytotoxic free radicals. Idaropicin inhibits DNA and RNA synthesis by intercalation between DNA base pairs and by steric obstruction. Although the exact mechanism is unclear, it appears that direct binding to DNA intercalation and inhibition of DNA repair topoisomerase 2 inhibition result in blockage of DNA and RNA synthesis and the fragmentation of DNA. Mitoxantrone is an anthracene-dione which is related to the anthracyclines. Mitoxantrone intercalates into DNA, resulting in crosslinks and strand breaks, binds to nucleic acids, and inhibits DNA and RNA synthesis by template disordering and steric obstruction. Replication is decreased by binding to DNA topoisomerase 2 and may inhibit the incorporation of uridine into RNA and thymidine into DNA. Mitoxantrone is active throughout entire cell cycle as cell cycle non-specific chemotherapeutic agent. Daunorubicin inhibits DNA and RNA synthesis by intercalation between DNA base pairs and by steric obstruction. Daunorubicin intercalates at points of local uncoiling of the double helix. Although the exact mechanism is unclear, it appears that direct binding to DNA intercalation and inhibition of DNA repair topoisomerase II inhibition result in blockage of DNA and RNA synthesis and fragmentation of DNA.